to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, agenda item 3, public comment. I don't believe we have any, so we'll move on to agenda item 4, approval of the August 13th, 2024 Board of Health Committee meeting minutes. All right, motion and a second. Any discussion? All right, hearing none, all in favor?
Aye.
Any opposed? All right, they're approved.
Moving on to number 5, approval of the September 4th, 2024 Health and Human Services Committee meeting minutes. Do we have a motion? Motion by Conway. Do we have a second?
I'll second.
A second by Foot. Any questions? All in favor? Say aye.
Aye.
Oppose? Okay, it carries. We're going to move on to number 6, educational presentations and joint committee discussion. A, substance use gap analysis presentation by Third Horizons Strategy.
All right, so I am Laura Scuderi. I am the Marathon County Health Officer, and I want to welcome both the Board of Health and the Health and Human Service meeting together, united. When I was on Board of Health, I actually was on Board of Health for 8 years prior to becoming the health officer, and we actually used to have joint meetings periodically, so it's fun to revisit that. And I'm pleased to bring forward this information today that will assist both groups in their ongoing mission to support the substance use needs within our community. Here's a brief overview of the process that brings us here today to review the substance use gap analysis. The Marathon County Board of Supervisors voted to use opioid litigation funds to contract for an analysis of service gaps for substance use within our community and obtain recommendations for the use of opioid settlement dollars. Through an RFP process, a consulting firm, Third Horizon Strategies, was chosen. Just a quick reminder that substance use prevention and mitigation strategies are both listed in the county's strategic plan on page 9, and is also included in our county's community health improvement plan. Third Horizon Strategies was chosen for their expertise in the area of substance use, behavioral health, and treatment. They have extensive experience working with government entities, and they have experts in the field of behavioral health and data analytics. And with that, I will turn it over to our meetings with our partners, or the meeting to our partners, Third Horizon, who have joined us virtually. If I could have help in doing so. Okay, Eric, you there? Can we turn the camera so that they can?
Can you hear me all right?
Yes, we can hear you, Eric.
They're on here, but
Oh, okay.
they
Great.
control the cameras.
Yeah, and Laura, if you're displaying anything on the screen, we're not seeing it,
Okay.
just so you're aware.
They're in the WebEx, correct? Okay, and they're not seeing what we're seeing on this screen? Okay. Hold on, Eric, we're just dealing with a little technical issue.
Yeah, no problem. All right, I can see it now.
Oh, you can? Okay, great.
Yeah. So, thank you for having us today, and I think
Eric, we can't hear
I
you
would
very
just
well.
like-
Can you adjust your mic a little bit, maybe?
right, can you hear me at all?
Yes.
Okay. Is that better?
Yes.
All right. Nothing can ever go completely smoothly with virtual technology, right? So, but it's a pleasure to be here today, and it's been a wonderful experience working with Laura and getting to know your community over the past several months. So we've been in this engagement for we're in our 4th month at this point. So, Laura, if you could just progress to the next section. We'll start off by going through just a quick background and review the project timeline. We'll also go over some national data that can kind of root things in context with where Marathon County and the state of Wisconsin sit within the national framework of what we looked at in terms of substance use disorder trends, and that would drill down into opioid use disorder as well. To really shore all of that up, there were a couple of approaches that we took. The first was really to take a deep dive into the quantitative data that was publicly available to us. So we will get into some of those insights as we move through the presentation. And then also, and in full transparency, this was my favorite part of this effort. We had 14 different qualitative interviews, stakeholder interviews with individuals in your community to really get to know what the experiences were from a wide range of individuals, including treatment providers, law enforcement, public safety, an individual with lived experience. So really look forward to going over some of those insights as well. And certainly we'll talk about our recommendations and then some concluding statements at the end. So feel free, Laura, to progress to the next slide. And we'll talk just a little bit about some of the root causes of substance use disorder to get everybody oriented. So in general, substance misuse and addiction encompassing alcohol and other drugs. So keep in mind, this is not just opioids, it's not just alcohol, not just methamphetamine, it's all of those things. And which the broader term for that is SUD, or substance use disorder. And you know, the where this really arises from is sort of a complex mix of social, psychological, environmental, and genetic factors. For those of you that are familiar with behavioral health in general, it includes mental health and substance use disorder. That certainly comes as no surprise. Individuals who have faced physical, emotional, sexual abuse may be at heightened risk of developing substance use disorders over time, and this is very well represented in the literature. So a couple of key things just to kind of root where things sit from the national perspective. The prevalence of SUD in 2024, about 17.82% of U.S. adults over, this is about 45 million, experienced substance use disorder in the past years. So of that cohort of individuals, 77% did not receive any kind of treatment. And this comes from a national survey on drug use that's conducted by the national organization that oversees substance use disorder and mental health issues in this country, called SAMHSA. So with respect to the overdose crisis that we're all too familiar with, overdose deaths increased about 130% from 2015 to 2022. So that really has heavily impacted rural communities throughout the country, especially during the opioid crisis and limited treatment access and a number of other things that have really contributed to that just incredible escalation of overdose rates over time. As a result, and we saw this through the pandemic as well, an increased demand for services over time, not surprising. And the need for behavioral health services in general, not just SUD, really rose with significant spike in conditions, including anxiety, which is about a 47.9% increase in substance use disorders, and a 27.4% increase since 2019. The mental health treatment gap, so in 2023, 55% of adults with mental illness, so over about 28 million, did not receive any kind of treatment. So again, this is a bit alarming, but to put that in context, again, SUD is significantly higher. And in Wisconsin, nearly 77% of adults with SUD need it, but did not get treatment. So that mirrors where things sit at the national level. So some of these issues are exacerbated by provider shortages in Wisconsin, of course, and Marathon County are not exempt from that. So Wisconsin faces a ratio of about 420 individuals per mental health provider. So that's higher than the national average, highlighting the need for more trained professionals. And we'll get into a little bit more about that throughout the presentation. Also, barriers to care. So unmet needs in behavioral health are linked to social drivers of health and various barriers that hinder access to necessary services. So we will also talk a bit about what does that mean from transportation insecurity perspective, and other kinds of things that can crop up, financial insecurities that really prevent people from seeking out treatment. So if you'd like to go ahead and progress to the next slide. I'll talk a little bit about, so we'll start with quantitative. So this is the numbers, the data that we looked at. And I have two colleagues on the call with me, Caleb Allen, whom you can see in hopefully see in one of the thumbnails, and then Elvina Faridi. The three of us worked diligently to put together the full paper, which is embedded within the document that you all should have received today. Caleb in particular really dove into the quantitative insights that we looked at, including looking at the publicly available data that I had mentioned earlier. Elvina really spent a good deal of time pulling together information that we gathered from our qualitative stakeholder interviews. So I may call on them throughout the presentation to add a bit more color as we go along. So just wanted to let you all know that they're with us in the meeting today. So from a methodology perspective, we pursued publicly available data sets that report at the local, state, and national levels. So think about it from that lens of macro going down to the micro level. That focused on behavioral health and social drivers of health, geographic regions, specific subpopulations within those regions. Data was gathered from the counties that border Marathon County as well. So when available, we looked at Clark, Langley, Lincoln, Portage, Shawano, Taylor, and Wood counties. So these data were sort of that contiguous county mean, which we'll show in a moment. Each geography is represented in all the graphs by the corresponding colors that we've got on the right hand of the slide here. So you'll notice that national insights are in a royal blue, state insights are in yellow, contiguous county are gray, and Marathon County is navy blue. So if you could go ahead and progress to the next slide, Laura. These are just examples of where our data sources came from. So to point out a couple, I'm sure most of you have heard of CDC data, CMS, which is the Center for Medicaid and Medicare Services, HRSA, United States Census. We also got tapped into some of the local data resources as well that you can see listed there. Feel free to go ahead and progress to the next slide. So just an overarching approach with respect to the quantitative data overview. I like this visual because it really puts SUD at the epicenter of the universe of data that we dove into. So kind of starting on the left-hand side and then going over to the right, the youth alcohol use survey data that we looked at. We also looked at youth drug use, adult alcohol use, adult drug use, youth mental health, adult mental health, and then again, those social drivers or social determinants of health. I may use those terms interchangeably, but they both mean the same thing. So if you can go ahead and go to the next slide, Laura. So these are some examples. We're going to dive into some more of the specific data in those content areas. From a social drivers of health perspective, there are 4 areas that we really looked into more deeply. And the first was housing. So one of the ways to think about this is what is the housing burden that individuals experience in our country. So you'll see here that for Marathon County, it sits at about 22% of individuals' household income will go to cost of housing specifically. And it's a little bit higher than the contiguous county mean, and a little bit lower than the state, and a little bit lower than the U.S. level. So internet access and housing choice vouchers, it's pretty consistent across the board. From a financial perspective, you can see some of the insights there as well. Marathon County is a little bit below the national average, and a little bit below the state average as well, a little bit above the contiguous county mean. Poverty rate, fairly commensurate with the national level and a little bit higher than the state and contiguous county mean. With respect to health insurance and access to health insurance, so this is more than just like the private employee-sponsored health plans or those that are on the healthcare exchange. This also includes Medicare and Medicaid coverage, and then we also factored in the uninsured rate. I'll start with uninsured rate. It's fairly consistent between the contiguous counties, the state, and then also at the United States level. Everything else sits relatively similar to other trends as well. So there was nothing that stuck out as being particularly extraordinary about the Marathon County experience with respect to access to health insurance. For food, so addressing food insecurity, you'll see that there's a percentage that's assigned to how much access do individuals have to quality food. You'll notice that the individuals who are on the SNAP program or food stamps is fairly commensurate across the board from the national, state, and contiguous county level. So, Laura, if you could go to the next slide. As I mentioned earlier, there were a couple of insights that we looked at for youth and adult alcohol and drug use. So we'll start with alcohol use from the youth perspective. Those that identify drinking before the age of 18, before the age of 13, you'll notice that there was a spike in 2019 where there was somewhere between 30 to 35% of youth in Marathon County stated that they had consumed alcohol before the age of 13, which is higher than the average for Wisconsin and at the U.S. level. With respect to drinking alcohol in the past 30 days, so the youth that were queried for this particular statistics, in 2019, again, a little bit higher than a more recent statistic, which was the most recent that we could get was from 2021, which was slightly lower than the state or the U.S. level. And then binge drinking for youth, you'll see was about on par, at least for 2021, at the state level and for Marathon County, and a little bit less than at the U.S. level. But it showed a downward trend from 2015 when that was originally queried. If you could go to the drug use slide for youth, Laura, you'll see here that a little bit lower for the drug use. So ever used a prescription drug without a prescription. So this would be an indicator that someone might use like an opioid medication that is not being prescribed for them. They may get it out of a medicine cabinet or a friend. So you'll notice it's a little bit lower than the statistic at the state and the national level. And then for marijuana use, again, is a little bit lower than what we're seeing at the state or the national level for youth. So there are some good things that we found in the data to show, at least for those two insights, that it's a little bit lower. If you could go to the alcohol use for adults, one of the things and this is actually one of the key takeaways that we'll talk a little bit more about, you'll notice that binge drinking and excessive drinking are either on par or a little bit more than the state level and definitely more than at the U.S. level. So from a contiguous county perspective, Marathon County sits a little bit higher in terms of rates of binge drinking and excessive drinking. And binge drinking and excessive drinking, there are specific definitions for that. That you can certainly find in the appendix that there is a reference to a SAMHSA website that has some more information about what constitutes binge drinking and excessive drinking. Alcohol-related mortality. This one's was an interesting insight. So these are deaths that are specifically related to alcohol. There may be an accident that's involved that alcohol has been identified as a primary factor, or it could be a long downstream consequence of excessive alcohol use over time. So it's a little bit of a mix of those two kinds of scenarios. But for Marathon County, it sits between 25 to 30 per capita in 2022, which is relatively higher than where we saw things at the United States level or Wisconsin as a state or at the contiguous county level. So if you go to the drug use insights in the next slide, Laura, one of the things I'll point out here is that the rate of opioid deaths, so this is opioid overdose deaths, I want to point out that this is an important insight. So from 2018 to 2022, there was a 200% increase in Marathon County for opioid overdose-related deaths, which per capita and when factoring in, that trajectory is quite a bit higher than what was seen at the contiguous county or at the state level. And you can see that also coming when we look at the rate of change for emergency room visits that are related to opioid overdoses there on the right-hand side. Over time from 2018 to 2022, Marathon County had about 100% increase over that period of time. And if you could go to the mental health youth slide. So I don't think I mentioned this earlier, but there's a significant comorbidity between mental health and substance use disorders, and whether that has to do with depression, anxiety, which are two of the leading mental health disorders in this country. Marathon County, again, not an exception to that. We've also seen an increase in suicidal ideation and then attempted suicide, starting with the pandemic and then going forward. Again, the statistics show us that with youth, both for Marathon County and at the national and state level, an increase since 2015. And for adults, if you go to the next slide, we looked at suicide mortality, which is on the right-hand side there. Marathon County sits a little bit lower than the state at the contiguous county level and about on par with where things are at with the national level. Interestingly, with poor self-reported mental health, so these are individuals who are attesting to not feeling well mental health wise. Marathon County sits a little bit below Wisconsin and the contiguous county mean, and you'll see that the United States is higher than all of them. So let's go to the next slide and talk about some of the key takeaways from the data that we just reviewed. So from a youth alcohol use perspective, high school-aged youth in Marathon County showed higher rates of alcohol consumption before the age of 13 compared to state and national averages, but lower rates of marijuana and non-prescription medication use. So thinking about potential ways to address that, certainly some of that falls within the realm of prevention, so which we'll talk a little bit more about in some of the recommendations that we made in our key takeaways for the entire report. From an adult alcohol use perspective, this was another key takeaway. Marathon County had higher rates of binge drinking and excessive drinking than contiguous counties in the state, approximately 7% above the national average. That's something that plays out in a number of different ways, and certainly with the alcohol mortality rate that we looked at. And then we'll talk a little bit more about what kinds of services can address some of those, some of the iatrogenic or the downstream consequence of excessive alcohol use when we get into some of our more comprehensive recommendations. Opioid-related ED visits, as I mentioned before, this increased by about 214% in Marathon County from 2018 to 2022, surpassing the increases in contiguous counties and the state, although the mortality rate per capita remains lower than the state average, which is a good thing. Mental health concerns, rates of self-harm, suicidal ideation, attempts among youth increased from 2015 to 2021, with LGBTQ plus youth reporting significantly poorer mental health. So that was a subset of the population that we looked at a little bit more deeply. That actually mirrors what we're seeing at the national level and also at the state level. So from that perspective. So Laura, if you could go to the next area. So we'll talk a little bit about our qualitative data analysis and our overview. As I mentioned at the top of our presentation, we conducted 14 key informant interviews, and Laura helped us curate a list of individuals to get connected to the county. We made some recommendations of individuals to get connected as well. Really to get a better understanding of the current landscape and to incorporate community voices from various sectors in Marathon County. Participants included, we had a couple individuals from the school districts, the two school districts that we spoke with, criminal justice, public safety, specialty SUD providers, so those on the ground who are treatment providers, community-based organizations, social services. We talked with local county administrators, advocacy organizations, and at least one individual with lived experience. The interview guide that we use for these key stakeholder interviews included questions on the current service landscape, significant care gaps, access barriers, including specific subpopulations, root causes for improvement, and some specific recommendations that they would want to pass along for the consideration in the report. So Laura, if you could go to the next slide. I want to start with some areas of success. This is important to recognize. You have a lot of good things going on in Marathon County. The Healthy Opportunities for Latin Americas, or OLA, was an organization that we were fortunate enough to connect with and would highlight. This is an organization that promotes economic advancement, civic engagement for workers and families from Latin America by helping individuals access health care, community resources, and legal resources. Raise Your Voice, which is a National Association for Mental Health campaign in the county to work at destigmatization and having open conversations about mental health issues in your county. H2N, which is an organization I'm sure a lot of you are familiar with, the Hmong and Hispanic Communication Network that collaborates with public health organizations, health systems, and other agencies with resources and tools to help improve health outcomes in the Hispanic and Hmong populations in Marathon County. Court diversion programs. So these programs allow for some low-risk first-time offenders to avoid criminal charges or convictions if they agree to successfully complete a customized agreement that the district attorney believes will benefit them in hopes that they will not repeat criminal behavior in the future. And this affects crimes related to substance use. I've worked at the national level. I've seen this work very effectively in other states that we've worked with. I was a clinician at one time in the state of Colorado, and these were incredibly important programs to help offset circumstances where people get deeper into the system, particularly if they don't have an opportunity up front, depending on the circumstances, to turn things around and to avoid sort of that albatross that might be hung around their neck for years. So this is an opportunity to really demonstrate some commitment and some success in addressing the issues that are really impacting their health and well-being. Also, the assessment and response team. This is a co-response model that sends uniformed police officers trained in crisis intervention and 2 North Central Healthcare crisis professionals to crisis calls in the county. So this was another one that we highlighted. If you could go to the next slide, we'll talk about some of the key themes. And just in the interest of time, I'll try and pick up the pace a little bit. Laura, am I going too fast, too slow?
You're doing great, Eric.
Okay. So some service gaps and barriers to care. Some of the things that we there were three major resources that the county relies on for substance use disorder treatment, and participants described notable service gaps that we also determined through our quantitative data analysis indicating insufficient access to treatment. And we'll talk a little bit more about what the specific levels of treatment are when I get into the broader near-term recommendations, which it will be in a couple of slides. Workforce and staffing. Marathon County, of course, is no stranger, as is most of the country. I live in a county in northwest Minnesota that has equally difficult time keeping staff, retaining staff, recruiting staff in the mental health arena. There's sustainably funding a trained workforce is a nationwide problem. And SUD, again, is no exception to that. In fact, there were some statistics that came out today that indicated that the need for SUD and mental health providers in this country is far exceeding the capability and the current individuals who are professionals in this field. So there is a significant need to recruit and retain professionals in Marathon County. So if we go to the next one, some additional key themes. There are some great cross-system collaborations that are going on in the county right now. However, in our qualitative stakeholder interviews, individuals did talk about services that are often siloed rather than being well coordinated or integrated across systems. Several stakeholders expressed a need for increased cross-system collaboration. They had some ideas about that. And some even mentioned that there had been a bit of an over-reliance on law enforcement agencies and professionals to address SUD concerns, which also mirrors some of the trends that we're seeing around the country. Local norms and community-based insights. According to many of the stakeholders, Wisconsin has a deeply ingrained culture of alcohol consumption, and the use of opioids and methamphetamine are come along with that. This cultural norm contributes to the state's high rate of alcohol use, binge drinking, and other substance-related health issues, posing significant public health challenges. So this was something that most of the individuals that we talked with either mentioned or agreed with. If you could go to the next slide, there are a couple other key themes here. There are some disproportionately impacted populations. So, this can lead into some of the participants underscoring that a lack of linguistically or culturally responsive treatment programs makes it hard for certain populations, including refugees, non-English speakers, people whose incomes are below the federal poverty threshold, and communities of color to really receive some of the needed services. Also, the social drivers of health that I touched on earlier, across all of the interviews, these were identified as some of the key factors that are impacting high rates of SUD, and that can be housing instability, income instability, education, access to transportation. All of those things impact individuals' ability to get, actually initiate and sustain recovery over a long period of time. So other areas of improvement that participants in the stakeholder interviews mentioned, a need to mobilize and expand current local and community-based group representation. So I'm going to look at that in the near-term recommendations. So local advocacy groups such as NAMI chapters are present, and there's community, but avid community representation is still somewhat lacking. Participants describe that community representation with county boards and advocacy groups is crucial to the success of addressing on-the-ground issues experienced by the communities, which makes sense. So, those individuals that are impacted by what they're seeing on the ground, they're really going to want to have some community input to how, what the county does to respond to that. So, if you could go to the next slide, we'll start diving into some of the near-term recommendations. Okay. So just from a broad perspective, just to give you a little bit of context, this is a slide that shows both our near-term and long-term recommendations. At the top half of this particular visual, you'll see 6 near-term recommendations, which we'll get into in a bit more detail throughout the next slides. And then we had a couple of long-term recommendations for consideration over time. So if you kind of think about it in those 2 areas as we move along. Laura, if you could go to the near-term recommendation number 1. And incidentally, these are in no particular order. These are all things that are equally important for consideration. Some may represent a lighter lift than some of the others, but nearly all the key informants interviewed described the county's need for withdrawal management services, or historically have been called detox. So I want to say that or maybe I should clarify. So enhancing the availability of non-medical detoxification specialty services or withdrawal management, it doesn't mean that there's not a medical intervention that isn't needed. It just means the setting. So in the paper, you'll see that the ASAM, or American Society for Addictions Medicine, breaks down levels of care. So historically, there's outpatient, intensive outpatient, and residential services, and then inpatient services. Throughout the course of those different types of levels of care, they have a number delineation for each of that. So outpatient is 1.0, for instance, and then they'll put a qualifier of a 0.7, for instance, when it's outpatient services, but it needs some kind of medical oversight. So when we talk about non-medical detoxification specialty services, we're talking about withdrawal management that can occur outside of a hospital physical health setting. So this would be a setting that does have medical professionals on staff, but it's not embedded within or taking up a hospital bed that could be used for other kinds of issues that are happening in the physical health realm. So as a result, I mean, this is something that Marathon County could potentially recruit provider organizations to fill that gap, put out an RFP and invite individual organizations who provide this level of service an opportunity to work with the county to expand access to that level of care. If you could go to near-term recommendation number 2, enhancing the availability of medication-assisted treatment. So for those of you that aren't familiar with medication-assisted treatment for opioid use disorder and alcohol use disorder, there are a number of FDA-approved medications for that. For opioid use disorder, that's buprenorphine, naltrexone, and then methadone. So depending on the medication, there are different levels of care that those can be accessed by the patients. So office-based opioid treatment, generally speaking, that's buprenorphine, or the trade name for that is Suboxone, and there are different ways that can be taken, including a long-acting injectable. On the other side, there's a full opioid agonist called methadone, which has been around for a number of years. That's monitored, and organizations have to be licensed at the federal level as an OTP, or an opioid treatment program, of which there's one OTP that's operating in Marathon County, and that's located in Wausau. So we had a couple of recommendations here. One of them is that the county could partner with OTP providers to ensure the successful expansion of mobile methadone units availability in several locations throughout the county. So my understanding right now is that the one OTP that's operating in Wausau does have plans to leverage a mobile unit to reach, I think it was the northern part of the county. But there may be some opportunities to go to other parts of the county. Marathon County is a big county. It's a lot of ground to cover. And to improve, and remember the barriers of access to care that I mentioned, transportation and security being one of the key pieces to consider with mobile units. That really takes and addresses that barrier. to have mobile units that are able to be dispatched in different parts of the county. So funds could be directed to Marathon County Public Health, whether through opioid abatement funding or other funding to support naloxone education and distribution campaigns as well. And again, more detail in the paper that is attached to this particular presentation. If you go to the next near-term recommendation, Laura. I mentioned earlier enhancing the availability of culturally specific services, including those who speak English as a second language. The federal government actually has some framework. It's called CLAS or CLAS. So this stands for Culturally and Linguistic Appropriate Services. So adherence to CLAS standards should really be a factor when considering grants and contracts with providers that are coming in to provide services in Marathon County. That's one way to really incorporate and kind of accelerate those opportunities at the county level. And again, to point out, Among American Center, OLA, and others that serve the needs of disproportionately impacted populations who may have challenges accessing services and programs that enhance opioid mitigation efforts. So Marathon County could consider offsetting some of the costs for those organizations to continue operating at a bigger scale for those populations. If you could go to near-term recommendation number 4, going back to some of the data that we looked at with the youth alcohol consumption in particular, promoting school-based prevention. So this is something, and we did talk with the 2 individuals from the school district who would be supportive of some additional preventive services in the schools to help address some of this. And again, bringing down some of those statistics could be a goal for those preventative programs. Adopting a public health approach to addressing the use of carrying of substances on campus, for instance, in lieu of immediate suspension or expulsion, including implementing and banning screening, referral to specialty SUD and mental health services on school campuses when available, can be an effective way to mitigate that progression of SUD-related negative health outcomes for the youth population. So if you could go to near-term recommendation number 5, Laura. So I mentioned earlier county voices. So individuals throughout the county having a voice and opportunity to weigh in on the SUD response at the county level, whether it has to do with bringing in providers to address one of the gaps that we've identified. So we're recommending that there's a formation of a countywide SUD response advisory committee that could include, but not be limited to a range of individuals, from those with lived experience to those with SUD service delivery for prevention, treatment, recovery, law enforcement, school district representatives, public health, social services, primary care providers, community-based organizations, and people with lived experience as well to participate in that. Which you certainly have individuals with lived experience in your county that can help shape some of the response. If you could go to the next near-term recommendation. So this is the 6th and last near-term recommendation that we made. So so before I came to my firm, I worked for Elevance Anthem. I oversaw the SUD and opioid overdose response strategy for the company. And I did that for the last 7 years of my tenure at Anthem. Did a lot of work in Wisconsin, Appalachia, and other states that Anthem touched. One of the things I gained a strong appreciation for was having an individual, subject matter expert, someone who really was the glue that would hold together many of the initiatives, the committees, really having an engine that helps to keep the momentum going for addressing some of these issues. It can get so incredibly complex. So having somebody at the helm with that at its core, having a position that would serve as that connection between historically disparate and siloed multidisciplinary SUD intervention efforts. And this is something that again came up with all 14 stakeholders that we talked about. So if we could go to I have two long-term recommendations. The first of which I mentioned earlier, one of the social drivers of health is housing insecurity. So Certainly having sustainable and affordable housing from a social driver of health perspective can impact a community's ability to contribute to a recovery-oriented community. One of the things that we noticed was a gap in Marathon County was access to recovery housing, which can be one of the cornerstones for a recovery-oriented community, one that recognizes that having someone experience a treatment intervention and then having ongoing support, because I think most of us know that for SUD, it's not a one and done kind of a thing or a catch and release a scenario. We can approach it that way, but what we find is that people become in and out of the system and actually run the risk of becoming an accelerant to the point where the condition worsens over time. So having recovery housing, for instance, can be something that can help support people over the long term. And there are some things that the county can do to help address that, and that might be putting out an RFP for organizations that operate recovery residences. Again, legitimate recovery residences that have a degree of quality standard so they could have some help with zoning issues and other kinds of things that the county could do to help acquire real estate and so forth. Long-term recommendation number 2, in the next slide, I mentioned earlier workforce issues. So again, Marathon County, no stranger to this, but there are some potential solutions around this, and this could be working with some of the educational institutions around the state that are working with individuals to get master's degrees, work towards being a clinician. That's one arena to recruit interns to come work in Marathon County, and then ideally not want to leave once they get there and experience some of what they can accomplish. Also, recovery community organizations. For those of you that aren't familiar with recovery community organizations, these are organizations that are led by peers or people with lived experience that can work in a number of different ways. They support one another, first and foremost, to go out into the community and extend a hand to those who are struggling, whether it's people who are struggling with an SUD themselves or their family members that are struggling with what to do with a family member who is struggling with an SUD. So this is an invaluable service that sits very well within the care continuum for substance use disorder treatment. So the county could create its own funding pool through an investment of county dollars to offset the cost of that professional and peer recovery support specialist recruitment. Educational loan repayment for those that are pursuing degrees in clinical counseling retention efforts designed to improve that pipeline of emerging SUD professionals to Marathon County. So Laura, if you could go to the last conclusion slide, and I'll leave you with this. Marathon County really has a unique opportunity to leverage available resources, including opioid abatement funds, to make significant strides in addressing concerns with opioid overdose and substance use disorder issues at large by focusing on identified key areas and working collaboratively. The county can build more resilient and supportive communities, ultimately reducing the impact of SUD and improving its residents' overall health and well-being. So with that, Laura, I'll turn it back over to you, and myself, Caleb, and Elvina are certainly open for any questions that you all may have.
Are there any questions? Supervisor Lemmer.
Thank you, Eric. This was a really informative presentation, and I've got just thoughts all over. But I wonder if you could talk a little bit more about the near-term solutions that you, or suggestions that you had, especially number 5, where it is to have a SUD advisory committee. I guess I'm kind of wondering if you can map that out a little bit. Questions, I guess, in my mind is how often would they meet and who leads it? Is it related to number 6, the SUD coordinator? So I'd just like to learn a little bit more about number 5.
Yeah, that's an excellent question. And yes, it does have to do with number 6. However, I would say that if the county opts not to move forward with the recommendation for number 6, it shouldn't preclude it from pursuing number 5, for instance. So, but ideally, the individual who would be hired to be in that position of being that linchpin or that individual who's the glue that's holding together some of these initiatives would be responsible for kind of chairing that committee and working with the county entities to recruit for that. Who defines who would sit on that committee? That really should be a partnership with the county board and public health to make sure that the community voices are variable and have a number of different opportunities for input, but also recognizing that it should strike a balance between individuals who are in the profession, individuals who are touched by those who have struggled with an SUD, whether it's a family member or they're a person with lived experience themselves, and then people in public health who are going to be experiencing some of the downstream consequences of SUD in the public health arena. And in terms of how often a committee like this would meet, I think that would really that would have to be determined by what some of the near-term goals that you all would select, and how much of a role that particular advisory committee would play in getting some of those things kicked off. So, I mean, if there's a specific goal that would need to be addressed, that particular committee could meet with a higher degree of frequency on the front end than it would on an ongoing basis when there isn't a specific deadline or output that's needed from that committee at any given time. So I think the answer would be that it would be variable and dependent upon what the needs of the county are with respect to this. I would say at least quarterly, at the very least, to be able to have an opportunity to look at the current data and to address anything that comes up from a public health perspective in near real time or real time.
Go ahead.
Just to follow up or say more about that, I serve on a United Way housing task force, and I think a lot of the things that we talk about are obviously related to some of the things you talked about with barriers to housing because people are experiencing SUD, and I would hope, just kind of broadly saying that maybe to some of the people in this room that this conversation, this presentation would be offered to some of those other community members that are working boots on the ground right now on this. And I'd love to hear more about how we can get this out to more of those people.
To follow up to that, and that was my question too, was, how do you see this either intersecting or being different than existing coalitions or boards such as the Alcohol and Other Drug Partnership? I would say that we would want to align whatever that looks like with existing committees or coalitions in the community.
Supervisor Moraz.
Thank you. This advisory committee and the people that are listed to participate looks a lot to me like who serves on the CJCC already. And in speaking about the CJCC, and we approved this gap analysis for $70,000. And in the packet from our Health and Human Services Committee meeting December 6th of 2023, we went through everything the CJCC determined would be a good use of our settlement funds. And much of that mirrors exactly what this gap analysis said. So what I'm curious about is, what did we find out from this analysis that we didn't know already? If there's anything specific anyone could explain to me, that would be great. That's my one question, so I'll follow up after the answer.
Well, the substance use gap analysis was a formal analysis. It's technically a needs assessment that was completed. It involved a comprehensive data analysis that the health department did not do with the CJCC. We did an informal data analysis at that time.
We had the youth behavior risk assessment done. Much of the information that was provided in here, we already did through the Marathon County Health Department. I'm curious too as to why are we missing 3+ years of data? A lot of the data in this report is from 2021 that's missing 3 years.
So in the gap analysis, it actually describes why, and forgive me, I don't remember the page offhand, Eric. If you have that offhand, there are some gaps in data, and some of that was due to COVID and lack of the ability to maintain data upkeep at that time. And I think it's on page 7 of the full analysis. It talks about limitations to data.
Yeah, and Laura, I don't have anything more to add to that other than to say that much of the publicly available data, unfortunately, there is a gap. So like CDC data, for instance, tends to be not near real time, but a couple of years gap with that particular data, for instance.
And then one last question in regards to suicides. Do we know, or is it documented anywhere, how many people who have attempted or commit suicide were on antidepressants?
We would have to look deeper into that. I don't know offhand. I can't tell you.
Thank you.
Supervisor Kroll.
Thank you, Madam Chair. Eric, this was a wonderful presentation, and you had talked about 2 types of data, your quantitative and your qualitative. I have one question on each. The first question is going to be, so there's a lot of talk about, there was a recommendation basically to promote a lot of the recommendations into specific languages. However, we didn't really receive any data like you specified if it's in Hmong or Asian culture or whatnot. So I'm curious if you have that information of the data that we received inside Marathon County, inside Wisconsin, if those are specific to like specific races or cultures.
Yeah, I'm not entirely understanding your question, but let me see if I can reframe it in a way that gets at what you're looking for. So are you asking whether or not the data has the ability to sort by race, ethnicity? For instance, like going back to the youth and the adult data that we reviewed. Are you asking if it has the ability to go beyond looking at that from an aggregate perspective and going into those specific populations?
Correct. If there's a recommendation to promote this in, like in many languages, I'm curious if there's an outsized need based on population. I guess, for example, if like the Hmong community is overrepresented in our Marathon County as having a major need, I'd be curious as to know those numbers.
Yeah. So, and I'll take a first pass at this question, and then Caleb, I'll ask you to dive into, because I know that you reviewed the data. To my knowledge, the data that we reviewed from the county, I don't believe that we went into to look at the specific ethnicities for each of the issues that we looked at, and we looked at it more in aggregate. And Caleb, I don't believe that we had the publicly available data that we had access to. I don't think we were able to split that hair. Am I correct in that assumption?
Yeah. Hi, everyone. Pleasure to be here. Caleb Allen is my name. And yeah, it's a really good question. All of what Eric said is what's most important. The other factor that's also important is When we're really trying to compare, for example, here, race and ethnicity data, it is a little bit difficult when the populations are so vastly different. It's something that we're constantly dealing with, in some of the data analysis that we do across the country. There are different populations and sheer numbers, making the comparison when available difficult, if that's helpful.
Great, thank you. And just one follow-up. I'm curious, in the stakeholder interviews, if you had any indication if any of these issues are cultural to either Marathon County or Wisconsin. Just based on some of the data, it looks like Wisconsin has fairly high excess of drinking issues and whatnot. So I'm just curious if you guys had encountered any of that as a cultural problem.
Yeah, and again, just to make sure that I'm crystal clear with what you're asking, are you asking in the stakeholder interviews, did we come across reports by the individuals that we talked with? Did they mention that it was more ubiquitous or a bigger issue within their culture?
Yes.
Okay. Yeah, I mean, we did, and so in talking with at least one of the organizations, they did mention that alcohol, for instance, is deeply rooted in their cultural practices and something that was concerning for that particular cultural representation. So from that perspective, there was a concern about that ability to, number one, acknowledge that, and then recognize that from a cultural perspective, it's loaded with shame, to even bring it up as an issue. So kind of overcoming that hurdle internally within their cultural belief systems is monumental in and of itself. Let alone then once kind of getting over that hurdle, having services that are available on the back end that are culturally sensitive that recognize, that sensitivity. So I don't know if I answered your question, but I think that we definitely did encounter that in at least two of the interviews that we had.
I think that helps. Thank you.
Any other questions? Oh, Gail. Supervisor Marshall.
Thank you, Madam Chair. I had a question on the near-term recommendation number 4, promoting school-based prevention, and it references drinking alcohol before the age of 13. I'm guessing that they're not drinking alcohol at school. So is the school prevention more appropriate to the families who, much like guns, you put your guns in a gun safe? You don't leave alcohol out for children. At least that's typically so I'm wondering, isn't the prevention better addressed to the families rather than the children?
So from a public health, oh, sorry, Eric. But let me just say
go
from my
ahead.
perspective real quick. From a public health perspective, we really like to take a several-pronged approach. So one of the things that we do in Marathon County is the Nurse Family Partnership, which actually is an in-home visiting model. It helps new mothers and prenatal mothers and their families. And so it does have outcomes that relate to lowering substance use. So we do something along those lines. There would be also an opportunity for us to do some kind of prevention within the schools that would address substance use in the schools itself. But we would have to look at evidence-based models in order to make sure that we pick the right one. And sorry, Eric, you were going to say something.
I was just going to mention that, one of the reasons that we're kind of thinking from a prevention point of view, there are certain arenas where we're going to have the biggest bang for our buck when it comes to connecting with our youth and their families, of course, and that's the school environment. So because it's a school-based prevention, it doesn't necessarily mean that it's only directed towards the youth. I mean, it's certainly something that can incorporate family education as well. It's just that, when the school is invested in working on these prevention measures, then what ideally will happen is that those messages will find their way to families in a number of different ways, whether it's the teachers communicating with parents of their students about what they're doing and having an awareness of that. So that's really what that is referring to.
Questions? Thank you, Supervisor Marshall.
I think it's important for all of us to remember that Lakeside Recovery are one of our major recovery services for detox and substance abuse was closed from, I believe, 2020, if not early or 2019, when they went into renovation up until just earlier this year. So we did lose about 4 years of having substance abuse services in our county.
Supervisor Marash.
Thank you. I'm just curious if you could provide more clarity as to how you would measure success with the position of the public health support person. What would their deliverables be, for example?
Eric, you want me to take this one?
Yeah, Laura, if you want to take this one, I know that we did it. We addressed this in a bit more detail in the paper, just to let you know. But go ahead, Laura.
Sure. So in the past, when we've hired like limited term positions or grant funded positions, generally what is determined is what is success for that position, especially if they're leading a group or like a great example would be like our Alcohol and Other Drugs Partnership. They decide a reason, a vision, a mission, and then they have measurable results that they go through. So at any given time, you can see whether or not we're making progress as a community towards improving whatever the result is that they're trying to reach. And that is one way. There's other ways that we also have a lot of, and you'll see in our annual report and in the public health annual report that we do each year, we actually do measure a great number of data points. And so that would be expected of this position. There would be established data points that we would need to see improvement on to understand whether or not we are making a difference.
Vicki Tilka.
Thank you so much. I'm not on the committee, but I appreciate you letting me speak. I just wanted to share things that I really appreciated about the report. One of them is that the emphasis of things that are going well in our community, because it's always important for us to pause and look at that and make sure that we have the resources and capacity to keep those things going. So I appreciated that. The other thing I thought was really helpful about the whole process was all the stakeholders being interviewed and having a voice in this needs assessment, which really strengthens, I think, their buy-in and again their collaboration around joining together on what is, I think, the recommended roadmap of what we could do differently, which I think is also helpful. Another area that I was looking as I was looking through the data, which is really spot on for us to either include in our grant reporting of grants that we currently have at North Central Healthcare, or even information to be able to write future grants. So that is another reason why I think it's actually very helpful. The last piece is I love the part about the workforce and literally the data about the credentials that we need, whether it's licensed clinical social workers or psychiatrists in our community, in Marathon County in the shortage, as well as Wisconsin in the United States. That was so helpful data. And I'll be sharing that with our HR department as well to inform recruitment and various strategies as we're looking at trying to grow our own within, which again is a long-term strategy. But those things were all really helpful to us at North Central Healthcare. So thank you.
Thank you, Vicki. I'll kind of piggyback off that from the healthcare perspective. Thank you, Eric, for the report. I think it's really helpful and does align with what we're seeing within healthcare as well. I will say that 760 of our 775 patients that were screened struggled with alcohol, some form of alcohol use. And so that is prevalent within our community. And so thank you for calling attention to that as well. I do appreciate the near-term recommendations, and I do feel like this is something we've talked about as a community often. And all these organizations are really doing great work. We're trying to do the best we can, but really to have that glue that kind of coordinates everything. So kind of that care coordination or community care coordination model would be very helpful in pulling this work together. And so I appreciate that recommendation from that perspective. We've had to do some of that work inside the hospital as we see the need. We've, tried to shift positions and hire positions, but I think, just collaborating across the community would be really helpful. And then I also have just one comment on the long-term recommendations. I appreciate also calling out improving the pipeline for some of these positions. One thing I will say about the peer recovery support specialists, we've had a lot of success using those within our hospitals as a way to connect our patients upon discharge. The issue that we're having, though, is that reimbursement. And so we spend a lot of our dollars, community health dollars, on reimbursement to fund the organization that provides the recovery coaching or the peer recovery support specialists for us. But that is an issue, is finding the reimbursement for those services. So thank you.
Any other questions? Supervisor Lemmer.
I think, going off what Supervisor Marash had said, this sounds like a CJCC thing. What are the next steps with this for us as a board? Is this going to them? How do we take this and go forward with it? And maybe that's a administrator question. I'm not sure.
I'm not sure if it's an administrator question, but I'll give you an answer, at least a suggestion. The next step for the report is, I know Eric and his team are going to come to the full board and give us this same presentation so the full board gets that information, because that was a suggestion that was made previously in some of the standing committee discussions. I think the question then of what are those next steps, just not to bleed into my presentation later relative to budget, but there are no allocations of this funding made in the 2025 proposed budget. So you do have, the board does have decisions to make about what are those next steps in terms of ultimately allocating funding. Similarly, the process by which you want to go through allocating that funding is a board decision as well. I'm happy to make suggestions. I think to Supervisor Marash's point, this came from the CJCC. We had a great many meetings with facilitation by the health department, just to root everyone again in terms of process, where we gave our anecdotal experience from our professional areas across, whether it's law enforcement, the courts, public health, social services, treatment with North Central Healthcare, and a wide variety of other members. We gave our kind of anecdotal experience, but the reason for this was, hey, are we off base? Is how we feel, supported by the data in the community. So that was the impetus for the CJCC to say, hey, we really need to kind of check ourselves whether or not we're on the right direction. The CJCC will get this presentation as well. I mean, I intend to provide it to them via a link. This meeting is, as over all your standing committees, recorded. So we'll provide that link. But the process question of what next do you want, you can decide. The board can decide what that looks like. Is that standing committee only? Is it a joint meeting of public safety and health and human services? Is it send it back to the CJCC for what we think those steps are? That's entirely up to you. Staff are here to assist in that work. And if you do want me to come up with a plan, a decision-making process, I'm happy to do that. I just There's one I just proposed for public safety in their packet coming next week. So we can do that, but the short answer is it's ultimately the board's call.
Question, would that be something that the full board would do? Is that something that we, as the Board of Health and the Health and Human Services, push forward?
It's a good question. Your board rules allow standing committees to take up items under their jurisdiction kind of at the discretion of the individual standing committee chair. That said, I know Chair Gibbs works very closely with standing committee chairs to try to come up with a coordinated approach. My suggestion would be that it would make sense for the full board to weigh in on that process because it does touch a number of standing committees, whether it's Health and Human Services, Public Safety, even based on the last comments, the Extension Education Economic Development Committee is touched tangentially with some of the economic development pieces. So my sense would be that the board would be well served to have the opportunity for discussion on what is our decision-making and allocation process look like, and of course, at the end of the day, because you're spending money, a lot of that also goes through HR, Finance, and Property. If you're doing budget amendments, which this would be, because even if you wanted to spend money this year or next year, because it's not in your budget as of right now, you can certainly amend the proposed budget to add it if you want. But there's a process for that as well.
Chair Gibbs, what is your thoughts?
Well, I think the administrator laid it out. I think one of the things we're going to have to do is going to have to, touch base with several different areas. One, the CJCC, the full board, and then the standing committee chairs, and come up with the approach as to the analysis that we use, take out of the recommendations, and then do a costing analysis as to how we're going to potentially apply some of those funds to some of the recommendations, and what are the outcomes that we're looking to measure to ensure that we're getting value for the dollar that we're spending from the opioid funds, and to ensure that they qualify for the recommendations or the requirements that the reporting does have as far as its use.
Thank you. Would there be something that we need to do today to move forward, or is this something that is automatically moving forward with the full board?
I think it's a little premature right now for one committee to move it forward. I think the full presentation will be presented to the full board and the CJCC. So I think there's opportunities there for feedback from all of them, and then we'll come up with an approach and present it to the multiple committees that are going to have input on it.
And I would just add, it's actually only on your agenda for education, today. So that was the purpose, because again, it's going to go to the full board, the County Board of Supervisors, this month for another educational presentation. And it just occurred to me as Chair Gibbs was commenting and all the people involved, it also could be a very good conversation perhaps at the executive committee to have that conversation about the process by which the board would make decisions about priorities and allocation.
Okay, thank you. Are there any more questions? Supervisor Conway.
Would it make sense at all to overlay the recommendations on the strategic plan update that we're doing anyway, since that comes from committee and has to be approved by the full board?
People are looking at me, so I feel urged to speak, but I think that's a great idea. I mean, many of these ideas are already in your strategic plan. They certainly are in your comprehensive plan, ensuring that the county is, your 2018 strategic plan had a really focused primarily on two specific substances that were of focus at the time, methamphetamine and opioids. But your comprehensive plan is more broad in scope, and in fact, the amendments you made, as I recall, in 2022, I believe, kind of took some of that specificity out to kind of capture the broader substance use disorder needs that Eric was and his team were alluding to. So I think that makes good sense in terms of, again, process that you have. The board has kind of laid out the desire to have a new strategic plan at the end, following the end of this year. You need to, if that's the true desire, you need to put that kind of near the top of the priority list and then have that dominate your agendas across your standing committees. But I think the idea that you offered makes logical sense, at least from my perspective. But again, whatever the standing committees and the board want to do in terms of process, staff are here to help.
Any other questions? Okay. Eric, thank you for coming and sharing with us, and we will see you in a few weeks with the county board. Thank you.
All right, then we'll move on to agenda item number 7. I'll take a motion to adjourn the Board of Health meeting. Motion, second. All in favor? All right, thanks.
So we're going to just hold off till they can exit if they want to, or you can stay if you want to, and then we'll move on to item number 8. Okay, I believe we can move on. Item number 8, policy issues, discussion, and potential committee determination for Health and Human Services Committee. A, discussion regarding 2025 annual budget development and policy recommendations from the committee, including review of the mandatory discretionary program, document, and discussion of rates and fees.
I can start us off. This item kind of flows well into what I believe is the final item on your agenda. Allow me to pull that up here, which is an overview of the 2025 annual budget, what to look for, and I'm not going to get into numbers on that. But this is an opportunity. Item 8A is really an opportunity for you to continue to ask questions. It is rather late in the game to make any changes. I'm pretty much just trying to put words to numbers at this point to explain it in the budget message. But if you did have questions about any rates or fees or any specific programs, certainly 8A would be a venue to have those conversations. Otherwise, Madam Chair, if you did want me to jump right into 10A, I'm happy to do that as well, which is, again, that overview of the highlights of the proposed budget at this point.
Is there any objection? Go right ahead.
Okay, so I talked about words and numbers. I'm going to try not to focus on the numbers right now because we're still crunching some of those, but I do want to, as the agenda item reference and as you put in it was adopted in your budget timeline, this is one of those meetings where to give you kind of what to expect so you can start to think about what, if any, as we just alluded to, budget amendments, if you want to start considering those, certainly give you some information to aid you in that. So highlights from the budget development process. Really, again, it was guided by a couple of things. Really the 3 questions that each of you as board members and particularly the chairs of your committees structured conversations around. The idea of what programs or services do we deliver is your first question, at what level and at what cost. So I'll try to go through those things. And then I'll start with kind of a disclaimer. This is largely a status quo budget. I'd love to tell you there was some really, truly new flashy thing, huge new program we're starting. But I don't think that's the case, but I will go through from each of the departments under your jurisdiction and each of the nonprofits that kind of relate to the work that you do, what you can expect. So, and if you do have questions specifically about any individual departments, feel free to ask. We have a number of them here. Aging Disability Resource Center, you'll hear the highlights really in their budget. This was the first year in, I don't know, forever, as far as I understand, since it was formed, Mike, that the ADRC did request from each of the member partners a small increase in their budget allocation. Again, that's that intergovernmental agreement between Lincoln, Langley, Marathon, and Wood counties that forms the ADRC of Central Wisconsin. The other big highlight is more of an operational one that you'll read about. That is, they're moving to the Lakeview campus with a number of other departments. But no real, from at least the county side, it's continuing to work on doing the things that the ADRC has done throughout its existence. In terms of the health department, this is one of the areas that one of the departments where this committee did provide some direction to me, as I again alluded to those three questions: what programs, what services, at what level, and at what cost. You gave clear direction. We had a couple of presentations from the health department about program expansion. One, the acceptance of the lead, I'll call it the subrecipient of a lead grant that the city of Wausau was accepting, and then also some expanded beach testing that would going to be overseen by the health department. You directed me to include each of those things in the budget, so they are included in the budget at this point. Social services, the primary thing that I think you'll see in their budget that we still have to get it drafted, but the idea, I think, I'm really excited about the idea. I think it's a great idea. I'd love to say we came up with it on our own, but other counties do this. Just for some context, we talk often about placements, out of home placements for children. That's a big part of our budget, but it's also central if you think about the mission of social services, is really to protect children who are victims of abuse or neglect. So if they're unsafe in their home, we do a lot of things to mitigate safety in home, which you frequently hear about, but we can't lose sight of the fact that there are some occasions when either on the child protection side, the child needs to be placed out of home for their safety, or on the juvenile justice side, which is the other part of social services where placements can occur, that sometimes courts order placements for children based on activity that they do. In all of the placements, whether it's a child protection side or a youth justice side, they are court ordered. Those placements, like many things that in each of our personal lives we've seen over the last several years, prices have gone up. That is certainly the case with respect to placement. So for a little bit of context, a year-long placement for a child in a level 5 group home is level 5 foster home, right? Level 5 is just shy of $600,000. The cost of a year in correctional placement for youth justice is just shy of $500,000. So when we try to budget, and we've done this forever in Marathon County, try to budget how many of each. Thankfully, we have a lot of placements on the kind of least restrictive side. Kinship placement, placement with a relative, or you talk about an out-of-home placement in a foster home. And we have relatively few on those higher end. But you can see any one, if you have a couple of youth who go out and make some really bad choices and you have 3 placements in correctional care at Lincoln Hills when you only budgeted for 1, you suddenly have almost $1 million hole in your budget. Similarly, a level 5 placement is $600,000 if you budgeted 1 and you have 2. So you have another $600,000. So, and we have historically relied upon funding within social services is a portion of that is levy. So it can really swing your levy amount. So we sat down and we thought about it. social services is no different than any other department in that I have made their life really difficult the last 5 years by saying you need to budget tighter. With that, based on what I just laid out for you, there's risk, right? You budget tighter, it's like, oh, we're going to do 0.5 of a placement. Well, you don't place 0.5 of a child. So we came up with a strategy to essentially create a high-cost placement reserve. So we are going to budget tighter, but we're going to set aside a portion, a small amount within the social improvement fund to only be able to be tapped into for high-cost placements. And we're going to start with a small amount of money. It's going to be $400,000, which is less than each of the placements I just talked about. But it will allow us to budget a little tighter because we need to. That's going to be one of the recurring messages you hear from me at all the standing committees and when I talk to the full board about the budget. I said it yesterday. I think I said, for those of you that think I have a money tree, I am sorry to disappoint. The levy limits are hard. So we needed to budget tighter. I think this is an innovative way. We're not the first county to do it. Other counties do it, but I think it's a good strategy for us, and it's certainly something I had to rely on to balance the budget. They also are continuing to do what we do in all of our departments with delivery model changes. Social services has historically contracted for a number of services. Recently, we've taken a number of those in-house just based on the fact that contract services are very, very expensive. So we're trying to evaluate when does it make sense for us to do that in-house. And Kristen and her team continue to do that. North Central Healthcare, Gary, Vicki, and Jason are here. They did an exceptional job on the budget. So the highlights that you'll see, a very, very minimal increase over last year. I want to say it was 0.5%. They're doing very well. The other thing I'm really proud of in their budget, and you'll see this throughout all of our county departments, North Central is undertaking a similar piece, and that is really implementing some data-based reviews of their programs, and you'll see targets, current levels and targets for a lot of their programs. We'll highlight a couple of those. Veteran Service Office, again, like all the departments, largely status quo. The big thing that is happening for Veteran Service, they're a small, very small but mighty department of 2.75 people. They're moving to the Lakeview campus as well. In terms of the nonprofits, I won't belabor the point. All of the standing committees looked at all the nonprofits that we currently have performance-based contracts with, and the recommendation that the county board ultimately approved was to continue to fund those at the levels in this year to the 2024 budget, and that is included at this point. Lastly, I'll say, again, largely status quo across the board. I didn't get from any standing committee any direction to cut or eliminate any programs or drop service levels. I don't think there's really any substantial increases in service other than the ones that I talked about before relative to the health department. No real program expansion other than where we were directed to. We were really driven by and strive to align ourselves with the direction from the board that you gave through the budget priorities, which was no use of the general fund to offset operational costs. There was no new levy-funded positions. We did walk a number of reorganizations through the process, the various standing committees. Most notably, we had a reorganization within the highway department and a reorganization within conservation planning and zoning. Those came at essentially a wash in terms of, or a slight reduction in terms of cost. That is really, again, one of the areas where I pushed. We need to be efficient. We don't have really much new money, if any. It certainly doesn't keep pace with inflation. So we need to be as efficient as possible in how we're organized. So that we had a couple of new positions there. We had a new position. Let me back up. We had a couple of new positions, but we abolished other positions. So essentially, again, a wash. We had a new position within the solid waste department that is going to be timed. The recruitment of that position will be timed with our gas well, enhanced gas well monitoring needs that are going to be correlated with our contract with the on-site renewable natural gas processing. And then the last position, which is actually just going to be going through public safety that next week. think it's next week. Next week, Tuesday, HR Finance on Wednesday is going to be a 1.0 sheriff's deputy position to be in compliance with a request from Rib Mountain to expand our contractual services. So that, again, not levy funded, just like the solid waste department position. Solid waste department position is being funded through renewable natural gas revenues that would be received from that through that contract that we have. So that's really from the new position side that you'll see. That again was one of those budget priorities. Compensation, again, the board gave clear direction through your budget priorities and budget assumptions, 3%, which I think is absolutely essential. We put that in there as well. In terms of health insurance, we'll give you more updates in the budget, but the direction the board gave was to maintain that quality of the plan, essentially sharing the burden of any increases. Not that Marathon County government is going to pick up all the increases, but that would be shared between a shared cost with employees. And then the other big directive that I didn't understand how big it was going to be until we're working to balance the budget right now is last year the board adopted a new capital improvement directive relative to rolling stock. And that was that we hadn't upped our rolling stock allocation. I think Jim Griesbach likes to say probably since I was in high school. I mean, it's been a long time. So the board increased that and gave direction that it would go up by either CPI or net new construction. I think we needed that. The challenge is you don't have new money every year in those amounts. I mean, when we talk about rolling stock allocations for the sheriff's office, highway, parks, it's well over $1 million. So when those amounts go up by 4%, we need to find that money. So that's been a challenge, but I'm happy to say that we did fund that in the budget. And we also we didn't quite meet the directive of the board that was, again, given a number of years ago to fund all necessary end-of-life and routine maintenance for capital. We'll present you essentially we'll present HR Finance, I guess, first, a couple of tough choices. Again, you don't have enough money to do everything, but we've largely met those needs. So again, I think staff have done an exceptional job. So the takeaway is I hope you're not expecting anything that's going to be all brand new and shiny. The budget will look different, which I think is good. It'll have some more data for context. But levy limits are such that we are really constrained to, it's a task just to do what we did last year. And the board gave some directives to do more. So it's really been a challenge. But we will get there. And I said I wouldn't talk numbers, but I'll give you one. I think credit to all the department heads. The budget, I don't know for sure what the number is going to be, but the tax rate drop is going to be significant. I have no doubt it's going to be in excess of 15 cents. So we're going to give you a budget I think we're certainly going to be proud of, but still have a lot of work to do. I have a lot of typing to do. Happy to answer any questions, however.
Any questions?
Two long presentations in one meeting, I think, makes everybody sleepy. But
Thank you,
Madam Chair.
Lance. All right, we'll move on to 9, operational functions required by statute, ordinance, resolution, or policy for Health and Human Services Committee. A, discussion and possible action by HHSC. There's none. B, discussion, possible action by HHSC to forward to County Board for consideration. That was pulled. Oh, number 1, I see that. Okay, thank you. And then Lance addressed 10, educational presentations and committee discussion for Health and Human Services Committee with his overview of the highlights of the 2025 annual budget with respect to departments and organizations over which the committee has jurisdiction. So moving on to 10B, discussion amongst supervisors regarding the takeaways from attending the Wisconsin Counties Association Annual Conference. Are there any supervisors that went that would like to share? Supervisor Radke.
Oh, yeah, I was glad to be able to go there. They had a lot of good workshops there. I mean, the two that really stood out to me that I went to was the workforce and population shifts, and the one on addressing the housing crisis. It was good to see what they were doing up in Ashland, Bayfield County. Kelly Westland was talking there, and you could tell it was affecting other counties, how much those two were pretty popular, those workshops. And yeah, it was very, and then the networking at the, at those conferences like that are really good. Seeing what everybody else, other people are doing in other counties. So.
Thank you. Anybody else? Okay. Here you go.
Sorry. I went to a discussion about the nursing homes in La Crosse County. And so there was one in La Crosse, the city, and in Sparta. I'm not sure if Sparta's in La Crosse County too. I don't know my counties that well, sorry. But the La Crosse County one, the Sparta one, they took their nursing home down and were rebuilding. Very interesting. They were talking about trying to really have a nursing home, but where people are living there and still able to drive and get around and just need some like assisted care, not the whole thing. La Crosse County did the same thing, only they were renovating theirs and they were putting a daycare in their facility, and also having like a disabled care place. And it was very cool, like Hogwarts, kind of like with one thing over here and then one thing over here and then one in the back and then the daycare. It was very cool, and we didn't get to hear enough. So, but I thought that was something that would be interesting to look forward in the future if that was something that could happen here, something cool.
Thank you. Was that adult daycare or child daycare?
Childcare, I'm sorry.
Child care, okay.
It was childcare.
Interesting. And what was the county?
La Crosse County.
La Crosse County. Interesting. Chair Gibbs.
Yeah, thank you, Madam Chair. So one of the things in Sheboygan County also did, and so one of the things that they utilized the creation of the child care center was a recruitment tool to add, one of the big challenges I had the Nursing Home Operations Committee meeting this morning, and one of the real challenges that nursing homes throughout the state are facing is a challenge around CNAs, around LPNs and RNs, and recruitment. And there's a statewide average is somewhere around 50% turnover rate. And so one of the tools that are being utilized by several of those counties is having a child care center and providing preference first to employees that are working in those nursing homes. And that has been hugely successful. So it's something that we've had brief discussions in multiple committees in the potential looking at some of the renovation down at NCHC potentially is leading to at least some additional discussions about that possible opportunity.
Thank you. Anybody else? All right. Moving on to 11, HHSC, next meeting, date and time, announcements, and future agenda items. Committee members are asked to bring ideas for future discussion, and our next HHSC meeting is Wednesday, November 6th, 2024 at 3 p.m. Do we have a motion to adjourn? Thank you. Thank you. All right, we're adjourned. Oh, I have to ask you all if you want to be adjourned. Does everybody want to be adjourned? say aye.
Aye.
Thank you. How about oppose?